All right, I see that it is 10:30, so we are going to go ahead and get started. Since we only have 30 minutes for this webinar, we want to be respectful of your time. So for those of you that have joined, thank you. Thank you for being here today. We're here for our fourth Medicaid Mini, Decoding the Codes. I am Jessica Emmerich, your Medicaid mentor and the Dental Medicaid Facilitator with the Missouri Coalition for Oral Health. We have partnered with the Missouri Dental Association and MoHealthNet to provide you all with enrollment, credentialing, and billing support. MCOH is a 501c3 advocacy organization. We're focused on policy and systems change to increase access to oral health services for all Missourians. You can learn more about MCOH and other upcoming events by visiting our website, Facebook page, Twitter, and LinkedIn. At last count, we had 176 registrants from across the state of Missouri. Those represent both currently credentialed providers and those who are considering it. So with that being said, we are here to meet you where you are and support you through the process and help answer any questions you might have. Today, we're going to focus on ME codes and how to determine what services participants are eligible for. Our session will be recorded and available to you after the webinar. Right now, all attendees are in listen-only mode, so you are muted, but you can submit your questions in the chat or the Q&A box. Both of those options are at the bottom of your screen, and we will address all the questions at the end of the presentation. So I'm going to go ahead and share my screen, and we will get started. This is Decoding the Codes. Okay. So I'm going to share a little bit more of my screen than I usually do. I don't just have the presentation, but I'm also going to show you the resources where you can find this information. So when people in Missouri are in need of assistance, they reach out to Family Support Division, and they collect their information and they determine if they're eligible for assistance and what services they are eligible for. Family Support Division then assigns them an ME code, which we use to determine what they're eligible for. So this is a chart that shows just a basic overview of their dental coverage. So you'll see it has MoHealthNet for adults, have limited coverage. Pregnant women, yes, they have comprehensive coverage. If you want a more detailed explanation of these ME codes, there's this provider resource guide. And right here, I have it pulled up for you. So if you scroll down, it will tell you what package they're eligible for, comprehensive or limited, the ME code, and what that means. So this lists everything out, whether they're limited, comprehensive, or if they don't receive benefits. You can also use this benefit table, which is very similar to what this is. This is dental specific. That bottom link will take you to this benefit table page where we can click on dental. And it prints out the same information. So I think a lot of providers probably print out this page just to keep on hand. This is a very good resource, just a quick glance. You can look and see if what they're eligible for and what services they receive. So all participants with MoHealthNet will have this medical eligibility code. This code is not listed on their MoHealthNet ID card, on their managed care cards. The way you will find this ME code is through EmoMed. So it's the provider's responsibility to check and determine if the patient has eligibility or not. A participant may show up with a MoHealthNet card. You still need to go in and make sure that it is active. So to do that, you can use the EmoMed portal, which is the MoHealthNet portal for billing and checking eligibility, or you can contact provider communications. This is an IVR, so there will be some prompts. You'll put in some numbers to determine if that patient is still eligible. This must be done for every visit. So when the patient has an appointment, that day of the appointment, you need to call and make sure it's still eligible. It can change daily, and you have to make sure they are eligible on that date of service. If you call in or you check EmoMed and it says they are not eligible, MoHealthNet will not pay that claim because they were not eligible on that date. When you're checking their eligibility, try not to span dates of service. You do have the option to put in June 1st to June 10th, but we do not recommend that because, like we said, eligibility can change. The only reason a provider would span dates would be because of spend down, which is a whole nother topic that we're not going to get into today. But if you're interested in that or have that situation come up, you can reach out to MoHealthNet. You can attend their trainings, and they have a presentation on their website that reviews that information. So we're not getting into that today, but try not to span dates when you're checking eligibility. You want to be date specific. Another reminder is that MoHealthNet is a payer of last resort. So if you are checking their eligibility and you see that this patient also has Medicare, or this patient also has, maybe they're covered through a spouse through their work, you would bill that other insurance first. MoHealthNet would be the payer of last resort. I have this education and training resource page, which is wonderful. This link here, this is where it takes you. Sorry for that. So there's a lot of good information on here that will really help. One that I go to a lot, so if I scroll down on this page, under general resources, eligibility and spend down overview. This is a very detailed presentation that will show you step by step how to check their eligibility, what spend down means, and everything you need to know about their eligibility, how to check it and what to do with it. This is also a really good place. I'm going to point out again these dental resources, great information. If you're ever interested in needing more information. And while we're here, I'm going to go ahead and point out the MoHealthNet provider trainings. So dental, you'll see that they have one coming up next week. This is a 2-hour live webinar where they're going to cover claims, eligibility, resources, everything you need to know to get started with MoHealthNet. You do not have to be enrolled with MoHealthNet to attend. You can attend as many times as you'd like. We highly recommend it for staff. So go ahead and register for that if you need more information. Okay, so you've had the patient come in. You've determined that they do have MoHealthNet coverage. You have looked up their ME code. You know that they're eligible. Now what? So now you need to know what services can they receive. So looking at this chart, I can see that an adult with ME code, let's say they have ME code 19, limited coverage. Okay. Limited adult coverage. This is a short list. This does not include everything. This is a short list of some of the services they receive. To get the specific information about the codes you can bill, you'll click this link right here, which will take you to the provider manual. I'll go to section 13. And here I can see a list of everything that patient is eligible for, along with any requirements or restrictions. I recommend using the provider manual to look up this information because, as you can see down here, this is updated more than any of the other resources I have. So if you see a provider bulletin that says, hey, we're going to start covering such and such, it will show up on here. So check the provider manual to see what codes are covered, what the requirements are. This is going to be an accurate source of information for you on what those patients receive. Okay, so then we go back to our chart and we have say we have a pregnant woman come in. ME code 18, yes, they have full coverage. Here is a list. This does not include everything. Once again, this is just a high level view of what they receive. We would go to section 19. Which is referenced several times. And now here I have a list of all the codes that are covered and any requirements, age requirements, limitations, and what the rate is. So you'll use your eligibility table to see what ME code they have and what coverage they have. Then you will go to your provider manual or your fee schedule to see what services they receive. Okay. So with that, we've been talking about the codes, and we know the rates have been increased, which has been wonderful. I just want to draw attention that this is a big increase for dental providers. This is a list of just some of the codes. This is not, everyone's office does not charge this. I do not know which insurance this is. This is just an overview to give you guys an idea. With the rate increase, Mo Health Net is paying just as much, if not more, than other insurances, which makes it a very viable source for providers. Also here, I've given you a link to the Mo Health Net fee schedule. So this link will go to this page right here. You will scroll down. We recommend not doing a download. It is a very, very large document. It will take a lot of time and it's very difficult to sift through. Instead, we recommend doing the full search. We will go to dental services. Now here's a list of dental services. Now what I ran into is that providers say, hey, I went there. It says 0. I don't know what to do. So type in a code that you're looking for. And then we can find those rates. Okay, so yes, the ones at the top where they didn't have any rates in. This is a list of all the codes. So these, the ones that have amounts, are the ones that Mo Health Net will pay. So if it shows 0, Mo Health Net pays 0 on that. If it shows 51, that's what Mo Health Net will pay. So for this fee schedule, this is the minimum of what the managed care plans will pay. This is for Mo Health Net, and like we've said before, managed care plans follow Mo Health Net rule. So if Mo Health Net covers it at $51, then the managed care plans have to cover it at least $51. So that is a high-level overview of the ME codes, how to know what codes your patients have and what services they're eligible for. I am going to go back to this page, which is very beneficial for providers, especially new providers. Any information you need about the codes, what they're covered, any of that stuff, attend one of these trainings. It's a lot of great information. They can go a lot more into depth than I can. Again, I only have 30 minutes with you all, where they will have much longer. So that is the end of my presentation, but I want to give you guys plenty of time. I knew there'd be a lot of questions about this type of this topic, so I want to go ahead and open up to questions. If you have any questions, go ahead and put them in the Q&A or in the chat box. Okay, it seems practices proactively check benefits prior to the patient's scheduled visit, such as the day before. As a reminder, it's important to also verify on the data service to ensure their ME code did not change, causing a benefit change. Yes. So especially right now, I'm sure a lot of you have heard about the unwinding. You've heard that term. Right now, Family Support Division is going back through and they're checking everyone, verifying their benefits, making sure that they're still eligible for their services and that their ME codes are still correct. For example, we've had some providers that said, hey, this patient that comes in, they've been pregnant for 3 years now. What's the deal? So the reason for that was with the COVID, they were actually locked into their codes. So now Family Support Division is going back and revalidating all that information to make sure it's all correct. So you could see some changes now. It's very important to make sure you're checking that information, especially the day of service, to make sure there has not been any change. There's a question, is this the same process for UHC or the managed care plans? So the managed care plans, you can use their portal to check eligibility. But what happens if you go in there to their portal and you check and it says, oh, they're not active? You also need to be able to go into EmoMed to verify. Maybe they've changed health plans. Maybe their ME code has changed. So you can use the managed care plans portals to check eligibility, but if for some reason it does not look right or it says they're not covered, you can always refer back to the Mo Health Net portal to see the whole big picture. Great question. As you can tell, we really stress making sure that you check that patient's eligibility just because that information can change And we want to make sure you guys get paid for the services you provide. We want to leave that there's no question that you guys verified that patient was eligible, so you can get paid for that service. Are you able to check UHC benefits on EmoMed? So you can use EmoMed to check the patient's eligibility, and it will show you which health plan they are enrolled in. I think that's what you're asking. So EmoMed will show you what health plan they're with and what their ME code is. That's the two things you need to know so that you know what services are covered and who you're going to be billing for that. I hope that answers your question. If not, please put it in there again. Okay, what other questions do you all have? I know there's got to be questions from providers, and typically if you're having the question, there's probably other providers with the same question. If a service isn't covered by Medicaid, what fee schedule do we go off of for patient responsibility? So if it's not covered by MoHealthNet and you're going to charge the patient for that, you need to have something in writing that says that patient's going to be responsible and they have to agree to that. I believe dental practices would usually go off what their office typically bills for that. But you need to make sure that you have documentation that they have agreed to pay for that, because you cannot bill the patient without telling them that they're going to be responsible for that when they have MoHealthNet coverage. I hope that answers your question. And if you attend the MoHealthNet training coming up next week, they can go more into detail about what that document is and give examples of that document that you need to have established so that that patient can pay for that service. Okay, I'm going to unmute Sarah. All right, Sarah, if you unmute yourself, you should be able to ask your question. Hi, Sarah, did you have a question?
She says, I don't have a question. Thanks, though.
Oh, okay.
Might want to take the raised hand down, Sarah. Thanks.
Okay, so there's a question. Are we able to have them sign a treatment plan that shows no insurance coverage and that be good enough? So I'm going to, Amanda, can I have you talk to that a little? About what exactly they need if they're going to bill a patient instead of for a service that isn't covered.
Yeah, can you hear me?
Yep.
All right, awesome. So the treatment plan, I know a lot of providers have asked about this. It actually has to be on the data service. So if you guys have a treatment plan, you can just have them sign on the data service saying that they agree that they are going to have to pay for that service. So it's supposed to be dated on the data service, procedure specific, and it has to be signed by the participant and provider. Provider meaning it's, someone in the office, that they agree, to be self-pay, because a lot of times participants don't know what their coverage is. So with MoHealthNet, like if we go into a doctor's office, we sign, okay, yeah, if it's not covered by our insurance, we'll pay for it. But with MoHealthNet participants, we want to protect our providers and our participants. So we ask for them to do that, which I know is a little time consuming, especially for dental providers when you have like a treatment plan and you're going to be seeing this patient ongoing. But that is something that we ask for you to do, because we do know that there's a lot of services that are not covered, and we just don't want you to be in a situation where it looks like you didn't tell them, and then, but I hope that answers your question.
Thank you. And that was Amanda Ferendorf. She's with MoHealthNet. She's a great resource. She is over at the education and training area. Lee is the specialist who will be working with the dental providers. She'll be the one giving the presentation on, I believe it's Tuesday, they'll go over the claims, the billing, the checking eligibility, everything. So those are two great resources. I've listed Lee's contact information here. If you want to reach out to them directly, they're more than happy to work with you in any way. If you have questions, if you want to set up a training just for your office, if you run into just an unusual situation, you're just not sure how to proceed, please reach out to them. They're very helpful and they want to help providers. We want you guys to get paid for this, and we want to help you with the billing process to make sure you get paid for it. Okay, a lot of good information so far. Anyone else have any questions we can answer while we're on here, or any other resources you want me to show you again? Anything I can explain better? Next week, we're going to start talking about the claims and how to process those claims. I did want to let you know that's going to be MoHealthNet specific. So I'm going to show you the MoHealthNet process and their information. Managed care plans do have their own portals for billing, but that's what we'll be covering next week. Anything else I can answer though about eligibility or what services they receive? Okay, there's a question that says, what is the quickest way to remove the third-party insurance on a recipient if it's already terminated? So
Oh, do you know what form it is, Jessica?
I don't. I was just getting ready to ask you about that.
Okay, it's the Insurance Resource Report form. It's found on our forms page, on the MoHealthNet fee-for-service page, which I believe, Jesse, I think you went there already. So it's under forms, and it's also called TPL4, but it's the Insurance Resource Report form. Let's see, we changed the format of this the other day. It should be in alphabetical order. Insurance Resource Report. You can also do Control F and do TPL. Just type in TPL and see if it comes to it.
I see it. It's in the second column, the second dot down.
There it is. Oh, she didn't put the
Insurance
name of the
resource.
form. I need to ask her to add the name of the form there again.
Okay.
So this form would just need to be completed, and you just email it into this TPL database email address. So they'll look at it, review it. We have like a vendor that does it for us, and they determine whether the insurance is active or not. We'll remove it, as well as if you find out they have insurance that we don't know about, you can add insurance here as well. It's really important that you bill the primary, even if we don't know about it, because what's going to happen is we're going to find out about it, put it in, and then the claim will, it have to be reprocessed and potentially be recouped, and you have to bill the primary. So if for any reason you know that they have one, even though if we don't know, please bill them and report it and fill out this form. This is a lot easier to report for a provider to do this than it is for a participant to reach out and report it. So we strongly encourage that our providers do this for us, and we do appreciate it.
Great. Thank you, Amanda. So like I was saying earlier, this page right here, the MoHealthNet provider page, has, like I said, it has everything, anything you have questions about, you can probably find it on this page. And if not, reach out to Amanda or Lee and they can help direct you to that information. A lot of great information there. Okay, there's a question. What if the patient does not tell the office about their other insurance? Amanda, any suggestions on how to handle that?
Well, first, I would just make sure when you look at EmoMed will show you that they have another payer if it's reported to us, like it'll show us on the system. So if you go down on the screen, it'll say, oh, they have MoHealthNet coverage, and then they also have another payer. But if for some reason it's not on there and they don't tell you, I mean, you're kind of in a little bit of a pickle, because eventually it'll be added to the system, hopefully. And then, yes, it could potentially reverse the claim, and then you would be asked to bill the primary first. But there are like some timely, like we kind of waive some of the timely filing rules when that type of thing happens, as long as, you know, you get the EOB or the remittance advice back from the primary saying, hey, they recouped it. Well, back from us, if you get that back from us and then you bill the primary, we'll work with you to try to get that claim to process again after you get, you know, the remittance advice back from the other payer, because we do realize that it's going to create some timely filing issues.
Mhm.
But yeah, this particular example is like Medicare, but it's the same thing. Like if they had like a primary, like say they had UMR or Delta Dental or something, it would show up on here and then you'd be able to see it and know that you need to reach out to that primary first. But like, you know, sometimes you don't know, but we just ask our providers to always ask and then fill out that form if you find out they have something else.
Like I said, if you have any questions or issues like that come up, reach out to Amanda or Lee. They want to work with you. Like, they want this to work well for you. We want you guys to be able to submit the claims correctly. And if something does happen by error or something needs corrected, they can help you with that and help you through that process. Okay, so there's a question. What if we are not in network with Medicare? Do we just submit it with EMOMed? So that I really recommend attending the provider training where they can go more into depth about that. If a patient does have dual insurance with the new fees that Medicaid has, will they pay the difference that the primary doesn't cover?
Hey, Jesse, I can answer that one real quick.
Oh, sure.
I can answer both of them real quick, which I know we have like 3 minutes, but I got you.
Sure.
Okay, so we know that Medicare doesn't normally cover dental, right? Like Medicare Part B. So you guys don't have to bill Medicare Part B. But we also know that there's those replacement plans, which we call Part C, say like Humana or something like that. And when you see those advertisements, you see, oh, they offer dental or they offer optical or whatever, right? We do require you to bill them. Sometimes they'll pay out of network, but we do recommend that you enroll with those plans, you know, because a lot of times they do have a dental benefit. So that's the answer to that. So if they have Part B, no problem. Part C, yes, you have to bill them. All right. And like Jesse said, you can attend one of those webinars and I'll show you exactly how to file those claims. And Lee and I'll be on there with Lee helping her through that. And the other question, if they have a primary, say they have DentaQuest or Delta Dental or whatever, some primary commercial insurance, they pay and then you report what they paid and we pay up to the allowable. So like she said that some of our rates are higher than the commercial rate. That's good because then we're going to pay that difference when that's sent over to MoHealthNet.
Thank you, Amanda. Okay, we have about 1 minute left. If there's any other questions you have, otherwise you can email me, you can reach out to Lee. You can attend the provider trainings coming up on Tuesday. Anything else we can answer before we conclude for today? All right, well, thank you all for being here today. We really appreciate your attendance, and we know that this is good information for you guys to have, and we really hope this will help you with the process of enrolling with MoHealthNet and billing MoHealthNet. Again, if you have any other questions, please feel free to reach out to me by email, text, phone, whatever is easier for you, or reach out to MoHealthNet Education so we can help you with this process. So with that being said, we are going to conclude for today. Again, thank you for being here, and I hope you will join us again next week.